Hey, this is Dr. Keith Hersey, and you are listening to the Destroying Diabetes podcast. Hello there again. It's Dr. Keith. Again, they tried to lock the doors, I think, but they let me in. So I'm just waiting for the day where the doors will be all boarded up and everything be padlocked, and they'll said, you don't need to come back in here anymore and do another podcast. Don't worry about it. But they haven't, so I'm here again. So I'd like to thank all of our listeners for supporting the podcast. And I would just encourage you to spread the word about this podcast. There may be some people in your life that have type 2 diabetes or may have pre-diabetes, or you may be taking care of someone that has type 2 diabetes. We have a lot of good information on this podcast, and I would just encourage you to have a friend, family, loved one to subscribe to the podcast, listen to the podcast, and the biggest thing of all, if you could rate the podcast and give a review. We look at all the reviews. We appreciate all the ratings. Hopefully you can give us 5 stars so that we can move up along the list of podcasts. And we're just trying to spread good information for you and your loved one about type 2 diabetes. You don't have to be scared of type 2 diabetes. Type 2 diabetes is not a death sentence. You will have to make changes in your life. I, as a type 2 diabetic, can personally attest to that. So it's not like you can go on as normal, because going on as normal has brought you into the condition that you're in. So to be able to alleviate some of the symptoms or even reverse the symptoms, you're going to have to put some work in. The biggest thing as far as work is monitoring what goes into your system that can drive up your blood sugar. And so just being more mindful of that is probably the biggest impact that you can make on your own as far as being able to reverse the conditions of type 2 diabetes. And I'll go over that in a future podcast about some of the things that's helped me as well. So be on the lookout for that. We have some good guests lined up coming up soon. I'm hopeful that you'll get a lot of good information from them. So just keep tuning into the podcast, and those episodes will be dropping pretty soon. So just be on the lookout for those episodes as well. We have some good guests lined up and coming up soon. The reason for the podcast today is just want to address a particular medication that I'm asked about all the time. I've ever since I've been even in pharmacy school, I've worked with this medication. It's probably the most popular medication used to treat diabetes, whether that's type 1 or type 2. It's called Metformin. And Metformin came out, I want to say about almost 30 years ago. I remember when I first started working in pharmacy as a pharmacy student, it was only available as the brand name, which was Glucophage. So that was a pretty cool sounding brand name, Glucophage. And then the extended release was Glucophage XR. And so, and of course, I think by the time I finished or first became a pharmacist, that's when Metformin became generic. And that was that was like a big step. And then now metformin is relatively, compared to a lot of other drugs and a lot of other generic drugs, pretty inexpensive. So even if you have to pay for it out of pocket, usually you can usually get like a month's supply for under $20. Maybe 10, depends on where you go. You could get probably even 3 months for under $20 or $30 at the most, even if you were just paying out of pocket. So this drug, like I said, is the most popular drug that's used for patients. And like I said, I've worked with this drug for pretty much like a little over 20 to, I guess, between 20 and 25 years. And first of all, it's called biguanide. That's what class it's in. Basically, just to simplify how it works, is that it lowers like your blood glucose level by decreasing the amount of glucose produced by the liver. And it also promotes insulin absorption. Remember, part of the problem with type 2 diabetes, the insulin that's produced is sitting out in the bloodstream rather than being absorbed by the cells, your tissues, so that it can be used to bring energy. So that's usually why your insulin levels, when you have type 2 diabetes, are like higher than normal, because they're not working in the bloodstream like they're supposed to. There is over excess, either because your tissues have become desensitized to insulin, so you need more and more to get the same effect, or just that your pancreas is just exhausted. It's just burnt out, basically, and producing more and more insulin, and just eventually burns out and produces as much as it can, and it's not getting into the tissues and helping spread energy throughout your body. So it's increasing in your bloodstream, which causes all sorts of nasty effects. Can affect like your organs, your blood vessels. That's why people with untreated diabetes, that they're at great risk for like heart attacks and strokes and eye damage and kidney damage, especially. A lot of times that's why people end up going on dialysis, because their kidneys are ruined because of the effect of the type 2 diabetes being untreated, and the buildup of insulin in the blood kind of wipes out the blood vessels. That's the biggest thing, that because it damages the blood vessels. So that's why it affects like your organs, especially like your kidneys and your eyes. Also, that's why a lot of people have nerve pain, because the nerves are frayed because of the damage of the excess glucose that's in your body, because it's not being treated and returned into the tissue. So it's sitting out in your bloodstream, causing all sorts of short and long-term damage if it's not treated. So that's why it's a specialty thing to really try to get your glucose levels down, get them under control, limit or minimize any glucose spikes, because the spikes in itself can trigger inflammation, and inflammation can trigger all sorts of damage and bad issues and other chronic diseases, and can help with high blood pressure, high cholesterol, arthritis. It may be linked to some dementia as well. So basically, like if you control like the amount of inflammation in your bloodstream, the less likely that you will have effects from these different diseases. It's kind of amazing how most of the major chronic diseases that we have in this country are linked to inflammation. Okay, anyway, I don't want to get off on the thing, but like I said, that Metformin, like I said, I think it became available in 1995 in the U.S. and it's probably the number one drug used to treat type 2 diabetes. Usually it's the most cases, unless people have something that would prevent them from using it. It's usually like the first line treatment of diabetes. Usually, like if they try lifestyle changes, usually first to see if they can get your blood glucose under control. And most of the time now, they even if you're pre-diabetic, the doctors will prescribe metformin because metformin does such a good job of helping keeping your blood glucose levels down that people don't now. Unlike before, people used to have a diagnosis of a type 2 diabetes, but now it's prescribed even if people are in the pre-diabetic stage just to get the blood glucose under control so they won't fall into full-blown type 2 diabetes. So metformin, like I said, is the most used drug. It's been studied probably more than any other drug because it's been out for so long. Usually, like the biggest thing with that is that you take it with food. And remember, that's pretty important. Try to remind my patients, especially when they first start taking it, to take it with food because one of the major mild side effects for most people, it's not usually a big problem, is that it can cause like stomach upset, can cause like gas, and probably like the biggest thing that happens to people is diarrhea. Now, usually the diarrhea, if your body adjusts to the metformin, usually it goes away. If you're taking it and say if it's 2 or 3 months after you start and you're still having the issues with gas and diarrhea and those issues, gut issues, then let your doctor know because they may have to change the formulation. Usually most people start off with immediate release metformin. That means that it works right away once it's broken down in your body. Usually they may switch you to like a extended release form, which that means that it breaks down, but usually it breaks down slower than the immediate release, but it lasts through a longer period of time. So usually they're just taking like once a day, maybe at most twice a day. Usually the effect of the medication is steady throughout the day. So you're getting the effect of the medication throughout the day than rather just like a peak in a valley. So, and I think now a lot of people now that they usually may not even go with the immediate release unless they're doing something more in a pre-diabetic prevention stage, or they're using metformin to treat another medical condition. They may use like more of the immediate release. Most of the things I see now is that usually like the extended release, even in the very beginning when people are first diagnosed, or even if people are pre-diabetic, a lot of times it's written for the extended release because less likely to have the side effects, which I said, like the stomach upset and gas and diarrhea. It can happen with the extended release, but usually it's less likely than with the immediate release. So I think a lot of the prescribers now go toward that because it's less likely to have those side effects that may discourage someone from taking the medication because of the side effects. So that's actually pretty good that we have this drug available. I've been reading stuff now that because of all the different uses that people are using it for now, that some people think that metformin may be like a wonder drug. Don't know if I'll say that yet. I want to see some more studies and research, but some of the research they've been looking at now is that they're looking at, especially with some of the things is more demonstrated, like as far as preventing of stroke, heart disease, that people that have diabetes and they're taking a metformin, that they're less likely to suffer a stroke or cardiovascular events than people that are not taking it. And again, I don't know if it's just like metformin or it's because of metformin's effect of lowering the inflammation in your body and lowering your blood glucose level, and that effect in itself makes it less likely to have a cardiovascular event. I don't know. It may be just the effects of metformin, may not be metformin itself. So hopefully more studies will be done with that. And again, they also said that it may prevent like cardiovascular events such as heart failure. It may also improve one's cholesterol profile. And because we have to be really monitoring about heart disease, because if you have type 2 diabetes, that you're twice as likely to have heart disease or stroke than people that don't have it. And again, the big problem is our friend, inflammation. Inflammation's in the house, and inflammation just makes it more likely to have these other diseases, such as like high blood pressure, high cholesterol, arthritis, certain cancers. So I think because of metformin, one of the good effects of metformin is that it works sort of like an antioxidant in some ways. And so it lowers those free radicals in your body, which are really dangerous, which leads to all the inflammation and all the bad stuff. So it's really good as far as type 2 diabetes, working with that. Also, again, they've shown that some studies have shown that it may help prevent the loss of eyesight among especially older patients. And that's a big problem with type 2 diabetes, is that because of the damage that the high glucose levels do in your bloodstream due to your blood vessels, especially some areas are more sensitive than others. Your heart, your eyes are especially very sensitive to it. Your kidneys. They're very sensitive to it, but it's not good for any of your organs. But and again, is it because of the metformin that works as an antioxidant, anti-inflammatory, reduces all that inflammatory throughout the body, and that effect reduces it in blood vessels, even the blood vessels in the eye. That is it the metformin itself, or just the effects of the metformin? And because it's the reducing the blood glucose and inflammation and all of the bad stuff that we keep talking about. So I'm sure you've seen like a common theme that so much of this is linked to inflammation. And the thing about with type 2 diabetes is that you have to really, the biggest thing that you can do, even more than lose weight, which that's a good factor too. That helps. That definitely helps. I'm not saying that, but you got to get your blood glucose under control. It's got to get into the normal range. That's where you start reversing some of these conditions. You want to reduce the nerve pain. You want to reduce the blurriness of vision. You get your glucose levels under control. You'll see that a lot of that stuff will resolve itself. But the thing is that you have to get it. You have to get it that way. You may have to start off with different medication. You may have to start off with metformin if your condition is severe enough, or if you've tried metformin and your glucose levels just continue to go up, and they may have to add, other products such as just insulin. They may have to add some of the newer products like the Mounjaro and Wegovy, those products, or Januvia. those products are usually added on if your blood glucose is not under control, especially after they're maxed out the strength of metformin that your body can handle. Um, Usually, you may not. Usually, if people are taking more than um, usually like um, maybe 2,000 to 4,000 milligrams of metformin a day. Usually that's like the max. Usually if you're still not getting relief of that, usually they're going to add another drug, or they may take you off of metformin and add another product to try to get your blood glucose level and your A1C down. So you got to really, like I said, the biggest thing is just getting control of that blood glucose level, and you got to monitor it. You got to monitor it every day, whether you have a CMG device, CGM, not CMG, CGM device. That's what I would recommend if your insurance covers it or you can afford one. I mean, I think that's the best thing because you can look at your blood glucose in real time. It'll give your doctor the best indication of how your blood glucose is doing, because it may be just naturally your blood sugar goes down like at night. So if you're only taking like your blood sugar readings like in the morning, it may be like it's normal, but it may be sky high during the day, but you don't know it because you're only testing once a day in the morning, and that's what the results your doctor is seeing. But when they do the A1C is through the roof, and they're like, well, it's obviously not being controlled because something's going on during the day. So that's why it's important to make sure that you're checking your blood glucose, that you have a blood glucose monitor. If you don't have a CGM, you just make sure to check it. Like you want to check it in the morning, of course, to see the thing overnight, but you may want to check it like 2 hours after a meal, and you may want to rotate the meals that you want to check it in. Like you may want to do it 2 hours after lunch. You may want to do it after 2 hours after dinner, just to give an idea of how your blood glucose is doing all day. Because if your meals are just driving your blood glucose through the roof through the day, but then your body is able to get it to come back down at night, then you're not really being controlled, and you're at risk for all these other things. And the doctor may not be able to catch it. And also, like I said, metformin is like a great drug. It has a good safety profile. The biggest side effect will be like some people develop like lactic acidosis, which is the buildup of lactic acid in the bloodstream. But that's rarely that's happened. And if it does, then of course doctor would take you off of it and try to find something else. It's also found that metformin in some studies may help with arthritis. And again, I think because of just helping decrease inflammation because of some of the anti-inflammatory and antioxidant effects of metformin. People that have certain medical conditions, like women that have PCOS, or that's like a condition that affects women in their ovulation, and it's been shown that it's very good with that. And then PCOS is one of the big factors in like infertility, especially in younger women. So that's one of the benefits that have been shown with metformin. Again, it's may be due just because of the lowering the inflammation, and the inflammation, like I said, affects all sorts of organs, even organs down there. So that's not really surprising that that's the case. Because metformin has been used in so many things, so many different studies, and used in different conditions. They're looking at it for the help, like with the lowering the risk of certain cancers. And those studies are ongoing, and it's not conclusive, but it may help decrease the spread of colon, breast, ovarian, and prostate cancers, and pancreatic cancer. But we don't know yet. And again, the antioxidant effect may be the cause of that, of metformin. They're also looking at it as far as trying to reduce the risk of dementia. Again, just like all the other conditions we talked about, dementia, the thing that's common in dementia is a high level of inflammation. So we have metformin that's helping reduce the inflammation, may reduce the risk of dementia. It may be just tied together. So I just wanted to give you just an overview of metformin. If you have any questions, feel free to email us, or you can call us at Hersey Pharmacy. We have that information in the show notes. And then also, I would like to put this opportunity out. Also, we're working on developing a new website that you can link directly to that. If you would like myself to work with you or work with a family member with their diabetes, and like I said, we're not limited through technology today. We're not limited by geography. If you have a relative in Oklahoma that needs help, or a relative in Alaska that needs help, I'd be glad to work with them. I'm offering a new area that's called just coaching with me, working with me, a pharmacist, to help get your diabetes. I can help guide you through the medications and side effects, and also just talk to you about the side effects, and somebody you can bounce questions off of as you go on your journey. Just somebody to give you like feedback on a regular basis in between doctor's visits. Someone that can advocate for you with your doctor if there's something's not working or changes need to be made, or there may be something with the medications going on that the doctors may not notice. I think it's a very great investment to work with someone like myself, a pharmacist that can you'll be really armed to help defeat this disease, or just manage it at the very least. You work with me, I can help you manage it. Some people's cases, I can help reverse the condition. So then we can help work with your doctor to ease you off of decrease your medications, and we can get you off of most of them altogether. I know that the unfortunate thing is that a lot of the medications today, especially the newer medications, are very expensive. Even if you have insurance, the co-pays are really high, or these prescriptions may use up your benefit before the year is out a lot faster, because they're very expensive, unfortunately. So if you can find a way to not be on them, I mean, you just save yourself the side effects and save yourself some dollars. So that's always good. But again, so I would like to just wrap it up now. Just didn't want to be on here too long. I just wanted to give you some information about metformin. Is there another drug or certain drugs that you want me to talk about? Feel free to email us or call us at Hersey Pharmacy. And it's still a reminder that it's still a good time to get like COVID updated, get your flu shots. You can come visit us in Durham. We can get that flu shots in for you in just a matter of a few minutes before cough and cold season, before the holidays get up. I know a lot of people are going to be traveling for Thanksgiving and Christmas. So you want to get all that stuff taken care of before you start traveling, especially if you're having to fly anywhere like long distances, something like that. You want to make sure that you're, armed up with your latest vaccines before the holidays, and you want to give it also like a couple of weeks before you have to travel, so that you'll get the max out of your vaccines, because it usually takes a couple of weeks in a lot of cases for the vaccines to get the maximum immunity to start coming in effect. So again, thank you for supporting this podcast. We love you. We appreciate you. And we look forward to talking to you soon. Just continue to be blessed. Thank you.
Thank you for joining us on this informative journey. The content of this podcast is solely the professional opinion of the host for informational purposes only. It should not be considered a substitute for professional medical advice, diagnosis, or treatment. If you're experiencing any health issues or concerns, we strongly recommend that you seek the counsel of a qualified healthcare provider before making any changes.